At Simply Modified, we are shining a light on the complexities of dysphagia. In our series Dysphagia Bite, we speak with passionate individuals who are at the heart of dysphagia care to share their practical insights, emerging ideas, and real stories from the field. These bite-sized interviews are designed to inform, inspire, and connect us all in the shared goal of better mealtime experiences. In episode 2, we chat with speech pathologist Chantel Kendle, exploring all things choice, how speech pathologists can help you understand your options and support mealtimes that feel right for you. A reminder that these interviews are for general education purposes and don't replace medical advice. If there's one message to take away from this, it's that dysphagia is highly individual, so be sure to connect with your own healthcare team for personalised support. All right, welcome to this Simply Modified Dysphagia Bite, where we spotlight important conversations around swallowing care and practice. Today, we're joined by Chantel Kendle, an incredible speech pathologist who works alongside me at Network Speech Pathology. Chantel trained in the UK and brings a wealth of experience across hospital, community, and specialist neuro rehab settings. She's passionate about supporting individuals in making choices, to advocate for themselves, and to feel empowered when navigating swallowing difficulties, especially when risks are involved. Today, with Chantel, we're going to explore the balance between safety, autonomy, and person-centered care in dysphagia. Welcome, Chantel.
Hello, Brie. Hi. Thank you for having me.
Thank you for being here. Okay, so Chantel, can you tell us a little bit about your work as a speech pathologist to date and why dysphagia in particular has sparked your interest?
Yeah, sure. So in my role today, I've largely worked with adults, both in the UK, as you said, and now here in Australia. So adults with communication and swallowing changes, and that's been across a variety of care settings, such as hospitals, for wards for people who are medically unwell, perhaps influenced by their age or dementia or a diagnosis of Parkinson's disease. On wards for people who've had strokes and brain injuries, or perhaps on wards for those who are nearing the end of their lives, as well as then in outpatient clinics and telehealth too. So dysphagia itself sparks my interest, partly because eating and drinking, swallowing, they're so vital for life, continuing our life, so maintaining our nutrition and our hydration, but then because they're so deeply personal and individual. So we all have our unique palette of taste preferences and likes and dislikes, different values around eating. Like I often reflect on myself being someone who lives to eat, whereas my family are very much people who eat to live. And then those social implications that impact on eating and drinking and swallowing, so like our family or our culture or religion. So dysphagia itself, I just find it a unique combination of the medical and then the personal and the human.
That's such a good point. And the fact that everyone has such a different experience of mealtimes from such a young age and how that cultivates everyone's values in such a different way. So then all of a sudden throw in some swallowing difficulties. We as clinicians have to consider everyone's person-centered differences when it comes to their management and care. That's such a good point.
Completely, yeah, very individual.
Yeah, big time. Okay, so diving into a little bit more around the decision making, let's
Mm.
start with this term that we come across a lot in practice, but for people with dysphagia, what does the term informed choice mean, particularly when it comes to managing eating and drinking?
Yeah, sure. So I think firstly, to make an informed choice, someone needs to be available of the options that are available to them. So in the eating, drinking, swallowing world, that's often, shall I follow the recommendations that are set out by a speech pathologist, this type of diet, these type of behavioral modifications? Shall I opt for items that are outside of the recommendations that a speech pathologist has given me, or would make to minimize risks? Shall I consider things like tube feeding, or shall I use a mix of all those approaches? So being aware of the options is the first step. Secondly, then it's having the knowledge and awareness of the benefits and burdens of each of those options, and the impacts that they have on someone's health and quality of life. So considering following speech therapy advice, that might be that, oh, this might reduce the chance of me choking or having a chest infection, but then I'm going to be avoiding foods that bring me pleasure and joy. Or if you're then electing against speech pathology recommendation, quite the opposite. So there might be an increased chance of health-related consequences, but you'd have a greater choice over your and control over meal times, and that might lead to increased enjoyment. So yeah, having that knowledge and awareness of each of the options and what their benefits and burdens are.
Yeah. And in an ideal world, when we are someone experiencing a condition like dysphagia, professionals, health professionals or medical professionals would just tell us all the information. But of course, sometimes that doesn't happen. May it be that we're in a really rushed situation within a hospital setting, staffing's reduced, who knows what's the issue. But for a client with dysphagia, what are some questions that they could ask their health professionals to become more informed about their condition if they feel as though they don't have all the information?
Yeah, sure. One of the big ones that came up for me here are probably how severe are my swallowing difficulties? It's likely that people haven't met anybody else who's had a swallowing difficulty and don't have that point of reference or comparison. And would you anticipate these to get better or worse? So digging around, finding out a little bit of information about whether my speech pathologist thinks these are temporary or long term, or the time duration that the recommendations that they've given might be required for, because that's likely to impact whether people believe that they could continue to fulfill or follow those recommendations. I think also asking what may the consequences of not following the recommendations set out by the speech pathologist be? So again, coming back to that idea of being fully informed and determining if they themselves are willing and happy to accept the risks associated with not following the recommendations. And finally, I'd probably say, what happens if I change my mind? As you say, sometimes as a speech pathologist in a hospital setting, perhaps that this can be something that we forget to tell people, but it is a right that people with dysphagia have. Their priorities may change and things may happen. So just making sure as someone with dysphagia that they're finding out how to access the appropriate support at another time with the right people on board if their choice does change.
Mhm. Yeah, that really integral part, even though I make this decision to follow a recommendation within the hospital setting, what I was told, of course, yeah. And then maybe a few months down the track, am I still considered needing to continue with these recommendations, or do I have the right to choose elsewhere or a different way? And you're right, we totally do. And this is where the next component comes in. It's dignity of risk. So can you describe this term now? So we have informed choice and then we have dignity of risk. And how does this come into play when it comes to eating and drinking or declining your speech pathologist's recommendations about what they could be using?
Yeah, sure. So dignity of risk, meaning individuals have the right to make the choice to eat, drink, swallow items that may involve some level of risk. And then other people affording that individual that right and respecting their choice and the autonomy involved with that one. So putting that in a context, so it might be that the speech pathologist has advised that the risks associated with swallowing are minimized by using a slow pace or having a diet that's soft and then cut up into bite-sized pieces, but an individual themselves loves toast and wishes to continue eating it. So sometimes it's about how can we as speech pathologists find a way to make that possible with a little bit of compensation perhaps, but without limiting that individual of that enjoyment.
Yeah. And as you said, it's so individualized. As speech pathologists, it's really hard if we put down a blanket recommendation on someone. For this person over here, that might really work. But for someone over here who values something different or has that preference or food that they really long for, it might not work. And that's where dignity of risk really comes into play with that sole word dignity being there. It makes a big difference for some people.
Mm.
Now, for decision making, there is also this particular part of that in the speech pathologist role in making sure that, okay, if we are taking on this dignity of risk for this particular person, we also need to consider their capacity to make decisions. So what does that look like for a client? And what can they expect when we are considering capacity? And how does that fluctuate a bit?
Sure, yeah. So, thinking about capacity then, I think as a health healthcare professional, like typically we're presuming that individuals have capacity to make that decision unless there's a reason to suggest they do not. So unless something that they've said or we've heard has given us that impression that, oh, maybe they don't fully understand the decision here. Um, when that arises, that's when a capacity assessment should be carried out. And I know in my role in my early career, when people said the word capacity, I was like, what does that mean? That sounds like something big and large. And how do I do that? How do I make a capacity assessment? Often that's done in a conversational based manner, or for people with communication changes or changes in their thinking, might involve some picture or written aids to support them with the process. But to have capacity to make a decision around eating, drinking, swallowing with risk, the individual, the person with dysphagia, needs to understand the decision, retain the information relating to it, weigh up the decision. So again, looking at the pros and cons of each choice of that decision, and then communicate their choice as well. So when it comes to fluctuating capacity, that's the idea that people may make choices at certain times, or may be able to make choices at certain times, but on other occasions they may not be able to demonstrate that capacity, whether that be due to illness or stress, anxiety, the environment they're in. So when people do show fluctuating capacity, my impression is that there needs to really be an assessment carried out when there is an indication of increased ability for decision making. So again, trying to give those individuals the best chance of making that decision themselves and having control over their choices. So when the situation is optimized medically, or when we know stress is managed, or they're taking them to a separate environment that's more conducive to making choices, and it might be more of a dynamic approach. So rather than having one conversation about the decision, revisiting it over a number of short sessions or conversations. But ultimately, as a healthcare professional, when we are in that situation, we're often probably working within a team and seeking second opinions as well.
Yeah, and I really liked your point there, that capacity can fluctuate. So as you said, in the right setting, the person might be able to make these decisions super clearly and have that ability to reason and consider those pros and cons. But in a stressful environment, or if perhaps they're medically a bit unstable, their capacity might be reduced. So it's all about revisiting it at a time that the person has that capacity. But for people that perhaps don't have the capacity to make decisions, so maybe we're thinking more about people with cognitive disabilities, or perhaps if there's a deterioration in their cognitive capacity, what is the role of the provider in supporting that client's team? So if a client does have dysphagia, what about the team around them, and how do we involve them in the decision making so that we can still uphold the client's autonomy, maybe their wishes before the decline had happened, in ensuring that they are eating and drinking the way that they envisioned?
Yeah, sure. So I think part of that is around involving family significantly, other people to make that decision for them. So a substitute decision maker. So me myself, I'd be consulting with the family around the individual's wishes, beliefs, interests. So maybe finding out some information about their prior mealtime routines, what they like to eat and drink. Again, like I touched on at the beginning, what their values are regarding eating and drinking. Do they eat to live to eat? Whether there's any cultural, religious, or spiritual beliefs associated with food. So family are going to play an integral role there. And part of the speech pathologist role, or provider's role in that case, then will be making sure that the family are very up to date and aware on the information from the most recent swallow assessment, the severity of the swallowing difficulties, the options available, the risks associated with both of them, potential consequences, benefits, so that they're best informed to help that individual make the decision that they can't make themselves. And that might be in more than one format as well. So not just conversation, but could be utilizing written handouts or leaflets, or providing them with extra time to process and reflect, because it's often quite a emotive or distressing or sensitive topic that people bring their own personal thoughts and opinions to.
Yeah. Really good point. And so I guess tying in that informed choice and decision making, it's so important that we apply those strategies with the outside team as well. So the family, the caregivers, anyone else that's involved in that person's care.
Yeah.
So how best, if people are maybe in the position where they are expecting a further decline in their condition, but they want to make sure that their preferences and values are documented, what are some of the tools that people with dysphagia and their caregivers can use to help get those preferences documented?
Yeah, so I think most commonly is the Advanced Care Directive. So that's a legal document that people can use to make their wishes clear about their future healthcare. And that can be a healthcare of any kind. So that does include preferences for swallowing, eating, drinking. So that's a great place for detailing whether there's anything you want to consider in the future, or more so if there's things you want to refuse as well, whether that be you have particular opinions about modified food textures, fluid textures, or tube feeding. Alternatively, I'm working with speech pathologists. They often will make mealtime management plans, formal documents created by us, tailored to the specific individual, and they'll outline the actions and instructions to care staff, their family, support workers on how to approach meal times for that person. So in ways that reduce their risk of choking or food and drink going the wrong way. So that might be, what modified food fluid textures are best or most recommended, what assistant techniques do they need, slow pace, positioning, any equipment that could be useful, with that overall goal of trying to maintain dignity of choice, but also minimize risk.
Good. Yeah, it's such a fine balance between the two, but so important. Rather than just gearing our role as being just about safety, it's really integral that we also consider those preferences and how they can be documented to advocate for those values within each individual. So we speak a lot about speech pathologists here, but the multidisciplinary team. So when we say multidisciplinary, it means involving the other disciplines and multiple disciplines that are so useful in someone's care team. How integral is it that we apply this multidisciplinary perspective and approach when it comes to eating and drinking for safety and individual preference?
Yeah, essential, basically. They're complex decisions and they can't be managed by one healthcare professional alone. And many areas of the decision do fall outside the scope of a speech pathologist to some extent. So you'll be needing medical staff, GP on board, particularly if we are considering an informed risk situation, so that they can be monitoring health, such as chest status. They might be at increased risk for chest infections, weight, hydration status as well. If someone's eating foods that are slightly more tricky with them, they might fatigue quicker and not get so much food and drink in. So there might be compromises from a nutritional and hydration perspective. Thinking along the same lines, then you might want to have your dietetics team involved. They might be thinking, is there anything more we can do to support this individual? Any supplements we can offer to ensure they do stay well nourished? Any tube feeding we might want to consider alongside the oral intake at risk. And then the GP as well, I'd be hoping that they'd be involved to make a risk management plan, particularly with regard to things like repeat chest infections. What's our approach to that? Do they need long-term antibiotics? Is that something that we need to think about? Would we be considering admission to hospital in the context of the individual's wider medical status? So lots of involvement from the GP, the medical team, dietetics, but then also, depending on the location of the person, the support workers or the nursing staff in aged care facilities, in the home, hospitals, to ensure that they have the capacity to provide adequate supervision, support, or risk mitigation at mealtimes that we as speech pathologists are recommending. And also to ensure they're fully aware of the situation so that we can address any training needs proactively.
Mm,
You
yeah.
could also potentially think about wider allied health as well from a OT or physio perspective. So postural and seating management, cutlery setup. So how best can they be involved to support that individual to sit upright as much as possible during meal times with the best tools available to them?
That's right. There's so much that comes into it. It's not just about the swallow itself. There's so many different influencing factors when it comes to what kind of the facilitates or the barriers that can come about when it comes to swallowing. And so it's integral, as you said, totally essential that we make sure a person with dysphagia is navigating their condition alongside other health professionals and allied healths, not just the speech pathologists. Okay, so why is it really important to remember that enjoyment and quality of life are just as important as safety when it comes to meal times? And is it possible to find a balance between all of them?
Tricky question, that last one. Yeah. Enjoyment and quality of life, yep, are just as integral to someone's overall well-being and life satisfaction as safety is. So as a speech pathologist, I can minimize all the risks in someone's life with regards to their swallowing, but without their perceived enjoyment or quality in their food drink choices, then this might lead to other health-related consequences such as stress, anxiety, not eating quite so much as they need to meet their needs, so reduced oral intake, and in turn malnutrition and dehydration. So other things might crop up no matter how well the swallowing side of things is managed. Is it possible to find a balance between enjoyment and safety? I think if it's the person's goal, then possibly, if that's what they're aiming for. But I think like any other behavior change or formation of a new habit, I think it's probably takes time and is a bit of a learning process. Some trial, some error. Like I've already said, will pose different challenges for different people as well.
Yeah, it's a hard one. And as you said, you will face some trial and error, some things that you think, yeah, this actually worked well. Or if you are modifying foods, that one tasted nice. It's nice trying to find that balance. But at the same time, as you've already mentioned, one day will be different to the next. So depending on everything else going on in your life, there are so many variables. But one thing that will help is having the team around you to help you navigate those variables and those risks so that you can continue to enjoy things the way that you hope to. So to conclude today, Chantel, you've flown through that really brilliantly, and thank you so much for sharing that. To end today, can you also share what would be your favorite food or the one that you go to when it comes to modifying textures? And what would you recommend for people who are navigating dysphagia? What's your go-to simply modified food?
I think I've got my speech pathologist hat on a little bit here, and there's some foods that I'm always just so in awe of because they're able to span the full continuum of the International Dysphagia Descriptor level, so IDSI, how we describe food and drink. So that's from level 7 of being our more regular to easy chew foods, right through to level 4, which is your pureed foods, and the in-between with level 6 being the soft and bite-sized foods. So I think things like pumpkin or squash, which can be steamed and chopped up or pureed to a soup or blended down to a root mash, or probably more personally, banana that you can again chop up, mash up, or blend to a nice smoothie. I find them so versatile. They're my winners.
Definitely. And they have that nice mix of savory, but also a fair bit of sweetness too. So you kind of get it. Love that.
Yeah.
Okay, well, Chantel, thank you. And thank you for joining us in a very important episode of Dysphagia Bite. Chantel, your insights remind us that dysphagia care isn't just about managing aspiration risk. It's about listening to what matters most to the person and respecting their right to choose. If you found this conversation valuable, share it with your loved ones and healthcare team and check out more resources at Simply Modified. Thank you very much.
Thank you.
Thanks for joining us. Stay tuned for more episodes. And remember, dysphagia is different for everyone, so reach out to your healthcare team to find what works for you. Check out the Simply Modified Whole Foods Cookbook for more dysphagia inspiration, or you can reach me at Network Speech Pathology.